Princeton Community Hospital loves National Hospital Week because it gives them the chance to honor the outstanding contributions of its staff. The theme for 2025 is #WeAreHealthcare and the dedication of those healthcare professionals. Newswatch reporter Jillian Risberg has all the details.
As we celebrate this week, we want our community to know that we do have these outstanding individuals that are here ready all the time, 365, to take care of them, if there's a need.
Since the pandemic, there's been some skepticism of healthcare. There's still going to be flu, COVID, and RSV. But as we move past that, Princeton Community Hospital's job is to instill trust, ensure you're cared for with quality and efficiency.
In a rural area, it is sometimes a challenge to recruit providers, and what I'm really proud of at WVU Medicine PCH is that we've really expanded our medical staff since WVU Medicine's taken over.
They added neurology, telemedicine, enhanced cardiology, and cancer services to ensure the community is being served locally. And Princeton Community Hospital's connection with Ruby and WVU Medicine allows them easy access to specialty care.
We have Bluefield campus that provides an emergency department as well as radiation oncology. We have our behavioral health services at the pavilion. And then, of course, here in our hospital we have an intensivist service that didn't exist until WVU Medicine PCH was able to align with our system. And so just great things have happened. When they come here at Princeton Community Hospital, they're going to receive the best care possible.
PCH's president and CEO Karen Bowling is concerned about anything going on at the federal level that would cut Medicaid dollars. She says 22% of West Virginians are covered through Medicaid, and 40% are children, mothers and children, veterans, and disabled people.
These are sometimes working poor people who need that health insurance. What happens when Medicaid gets cut, and depending on how it's cut and what the federal government decides to do, is that it makes people fearful. If they become uninsured, they don't access the healthcare system like they're supposed to for screening or primary health care. And guess what happens? When do we see them in the emergency room? When they're the sickest.
PCH has strong feelings about the certificate of needs, important in a state like West Virginia, by protecting existing hospitals from unfair competition.
We have a high population of both Medicare and Medicaid patients, and our population, tends to be a little bit sicker because of our health statistics. And so we advocate with our congressmen and our senators. We let them know, that we're here. We want to be able to care for all of our citizens, regardless of their ability to pay. Very fortunate that the legislature decided not to take that up this year, and that our current laws are still in effect.
A native West Virginian from Wyoming County, Bowling says being in the position to make a difference means so much to her.
We're taking care of my friends, my family, my neighbors, people I know. And to be a leader in an organization, to be able to impact policy, to be able to impact change, to make sure we're recruiting the right specialties, one of the most important things I've ever done in my career. As an organization, we try to think, what impact does that have on the patient? And what impact does that have on our employees?
At Princeton Community Hospital, Jillian Risberg reporting for Newswatch.